Good afternoon, everyone. Welcome to each and every one of you for today's Mentoring at Purdue or MAP workshop virtual webinar. My name is Levon Esters, and I'm a professor here at Purdue University and the lead co-director for the Mentoring at Purdue program. And I'll be moderating today's session, which I'm hopeful and I'm sure that all of you all will enjoy. So today's workshop virtual webinar is Effective Mental Health Strategies for Mentoring Through COVID. And we have three wonderful panelists that are going to join us today. And just let me read a little bit of excerpt from the flyer. So, which is COVID-19 has impacted the way we learn, work, and interact with others. During these uncertain times, it is important to monitor our mental health and look out for one another. This workshop will feature some effective mental health strategies and tools that can be used to assist with virtual mentoring. Please join us for this discussion on how we can be proactive facing the challenges of COVID-19. And so the way our format is today, everyone, is that in a moment, I'm going to allow Dr. Jones, and Pearl Lowe to introduce themselves. And then after that, I'm then going to jump into asking the questions. And so I would encourage each of you to do is if you have questions, please place them into the chat. I have members of our team that are monitoring those questions. And at around 12:45 or so, we're going to stop the Q&A the portion of me asking questions, if you will, the panel, and we're going to open it up to those questions in the chat. So that's how we're going to flow through today's session. So again, be mindful of what you want to ask. Please place them in the chat, and we'll get those answered as best we can. And then also I want to share that there will be a recording of this webinar sent out on Monday. So be on the lookout for that from Stephen on our social media, email, so on and so forth. So without further ado, let me start. And I would like to go in the order that you all on the slide, Dr. Joe, Dr. Jones, and then Pearl. So Dr. Joe, we'll start with you by just introducing yourself and your role at Central Florida.
Great. Good afternoon, everyone. My name is Richelle Joe. I'm an assistant professor in counselor education at the University of Central Florida in Orlando. This is my 6th year in that role. Prior to coming to UCF, I served as a high school teacher and a middle school counselor in Virginia, and now I have the joy of teaching graduate students to be counselors. My research at UCF focuses on mental health concerns for underserved and marginalized populations. Specifically, that includes communities of color, under-resourced communities, and individuals and families affected by HIV. I'm excited about this panel about mentoring. Mentoring is a central part of what I do, and I try to mentor in multiple ways and in all the areas of my work. So sometimes that's formally, sometimes that's informally. I mentor our doctoral students in their teaching and clinical supervision, as well as aspects of their research. I also mentor outside of my university. I'm a mentor for the National Board of Certified Counselors, their Minority Fellowship Program, which I had the pleasure of being a part of when I was a doctoral student. And so I try to give back through that program as well. So I'm excited to be here. Thank you all, and I look forward to hearing your questions.
Dr. Jones.
Good afternoon. My name is Angel Jones. I'm on the faculty at George Washington University in the Higher Education Administration Department. My research broadly focuses on the experiences of Black and Brown students at historically white institutions, but more specifically, my work looks at the impact of racial microaggressions and racial battle fatigue on the mental health of Black and Brown students. Similar to Dr. Joe, prior to embarking on higher ed, I was a middle school and high school counselor in Atlanta, Georgia. I'm happy to be here.
Thank you, Dr. Jones. Pearl.
Hello, everyone. Thank you so much for inviting me to be here. My name is Pearl Lowe. My pronouns are she, her, and hers. I'm currently a PhD student at the University of Maryland, College Park, with a concentration in student affairs and higher education. I'm also a resident director here. I have a background in resident life, and my research interests focus broadly on cross-racial interactions and friendship groups, particularly amongst peers of color. Specifically, I look at Asian Americans and their Black peers, anti-Blackness in Asian American communities, and how Asian Americans can become better allies for their Black peers.
All right, thank you, everyone. So I'm going to jump right into the questions today. And so we have 7 questions, everyone, and I'm going to try to get through as many as possible. But again, at around 12:45, then we'll maybe stop around there and open it up to the audience. So for the panelists, the first question we're going to start with today is, what have you done to make your students feel comfortable enough to express their mental well-being with you? So whoever wants to start.
I can start. I think for me, I think it's important to just ask questions. I feel like as educators, especially as a professor, I think we often focus on content, but I feel like right now, if the mental health of our students isn't in a good place, they're not even going to be able to comprehend or even focus on content. So I genuinely start each class asking them what they're thinking, how they're feeling, and things like that. And I feel like when you show them that it's important to you, they feel more comfortable being open about it. And I also think it's important to model that behavior. I don't tell my students all my business, but I do let them know, like, I'm struggling. Like, this is a very hard time for all of us. And I think being transparent and vulnerable with your students gives them space to be able to do the same thing.
I agree with Dr. Jones. I would say that my situation is a little bit unique because I interact very closely with my students because I live with them. I live in a chapter house, so we see each other in pajamas, we see each other very late at night. And I think what has helped has been setting boundaries and sort of distancing myself a little bit so that they can see me as someone who is a professional, someone who has experience in student affairs, and someone who can provide them resources going beyond that of a friendship. And sort of going off of that, I've learned that I really have to walk the walk, not just talk the talk. When they need me, I like to be an advocate for them. When we had a student test positive for COVID, they saw how hard I was working with the rest of the administration to make sure that they were going to get fed, that they were going to get housing. So being an ally for them, being an advocate for them, made them realize that they can trust me, they can open up to me.
So the advantage that I have in a counselor education program is that our program focuses on mental health. We're preparing people to be counselors. So I think our students have a level of expectation that their faculty members will be people that they can approach. However, that's not always the case. And so I try to go above and beyond that to make myself available to my students and also approachable. And I'll do that in multiple ways. We talk in our field about broaching difficult topics, and sometimes this is a difficult topic. So I'll acknowledge with my students that their academic studies in their life right now are inherently stressful, and that being a person of color, being a woman in this instance where we're dealing with both COVID and racial injustice just compounds all of that. So I kind of front load interactions with my students with that information and normalize any concerns that they might be having so that they know that, okay, this is someone who I can approach because I'm dealing with this a little bit differently than maybe I've dealt with it before. And then, of course, it's important just to be empathic in those interactions and communicate unconditional positive regard to students, that I want to hear what you have to say. I want to understand how you're feeling, and I'm going to support you so that you can get what you need.
Thank you. So I really appreciate what you all have shared thus far, which brings me to this next question, which I think is a very good follow-up. And if you don't mind, I would like to start with you, Dr. Joe, with this question, and then move on to Dr. Jones and Pearl. So Dr. Joe, the question I have is, what are some potential warning signs to look out for when people are facing a mental health breakdown or crisis? Because I imagine there are a lot of folks on this call today, staff and faculty included, right, that may not know what those warning signs are. So how would you respond to that question?
A very important question. And really, for us to know when we see something that is of concern, it starts with knowing our students. So we have to have somewhat of a baseline of who our students are, how they typically interact, how they typically communicate, so that we we can know when there's something that's different. And that something that's different could indicate that there is a higher level of concern. So if we are noticing that a student is late or is interacting differently with peers or with us as faculty, that's something to take note of and maybe talk with the student about to see if there are some additional concerns. So changes in behavior are going to be important to note, but again, we have to know who our students are first and then get a sense of, is this qualitatively different, and is it enough of a difference that we might be concerned? I would say also, if there's any vocalized indication of harm to self or harm to others, we absolutely have a responsibility to ask questions, to follow up, and to act. So this means that we might have to bring up conversations about either suicidal or homicidal ideation. And we might have to ask students if they have thought about harming themselves or if they have a plan to harm themselves. And then we have to know what resources are around us so that we can respond to that. Again, I'll go back to, we have to have a baseline of information to know if what we're seeing in students is enough of a difference that we should be concerned, and if it's impacting their ability to function, to interact with other people, and if there might be a concern about harm to someone, be it them or someone else.
Oh, good. Dr. Jones, we can go to you next if you don't mind.
Not surprisingly, Dr. Joe was right on point. Everything that I was going to say. So yeah, and I think when you're thinking about changes in behavior, I think it's important to talk about that, just because it doesn't present the same in every single student, right? So what's like she was saying, like you have to know who your kids are. Well, I call all my students my kids, but like you have to know who your students are in order to be able to see or be able to tell that there's a change in behavior, because there are some students that are very, quiet and isolated. But if they're always like that, then that won't be a sign. But if there's a student who's normally super engaged and super excited and vocal and things like that, but they become quiet, then that's how you can tell that there's an issue with that particular student. And I also feel like if you maybe don't know your students, just be willing to ask them questions, right? So if they're talking to you about like, yeah, I've just been in my room a lot, asking them like, oh, is that typical for you, right? Are you always someone that likes to be by yourself and likes to be in your room, right? Because we're not going to intimately know every single student, especially depending on how many we have. So just being willing to have these open and honest conversations with our students.
Good. Pearl.
I think Dr. Jones and Dr. Joe pretty much covered all of it. I would say that for my residents in particular, I notice if they're physically not as present, if they always eat lunch at a certain time, if they're just not showing up. I guess you can see sometimes where they're not just physically taking care of themselves, whether it's showering, not eating, not doing homework, not showing up. So I think those are some of the things that I look out for. But again, it differs for every single student. I have residents whose faces I've only seen twice since living here, but that's just because they like to keep to themselves. But other people who I see every day, if I didn't see them for a couple of days, I think that would be a little bit of a red flag for me to look out for. So I definitely think it just depends on your students and getting to know them.
Good. So Pearl, I'm going to pick on you in a good way, right? First with this next question. So the question is for students who only have a service level relationship with their advisor, how should they go about expressing their mental health, their mental well-being with their advisor? So I will start with you from the
I think that's a very good question, because I'm a new PhD student and I have not been able to develop a very close relationship with my advisor yet because they're on paternal leave. So I haven't physically or even really Zoom met them yet, since they went on paternal leave in August before the school began, and they're not really going to be back until December or January. With that being said, I do feel comfortable speaking with her, and I like to remember that this pandemic, the crises that are happening are affecting every single one of us. And so what I'm experiencing, what I'm feeling is not unique just to me. I'm sure that she has experienced things, especially as someone who gave birth to a new child during the pandemic. Like, she knows what being overwhelmed feels like. She knows what anxiety feels like. She knows what stress feels like. So for me, keeping in mind that even though we are distant, even though we haven't really interacted, we have gone through a lot of the stresses of the world. is really helpful just to keep in mind, so that I can just share that with her and not be sort of ashamed or embarrassed about sharing that.
Dr. Jones, we'll go to you next. How would you respond to that question for students who have a service level relationship with their advisor? How should they go about expressing their mental well-being with their advisor?
Honestly, I feel like the first thing the student should do is ask their advisor if they even feel comfortable engaging in those types of conversation, right? Because when it comes to mental health and well-being, it's not everyone's ministry, so to speak. And I feel like if a student is courageous enough to get open and then doesn't get the response that student needs, that could be traumatizing to that student, and we definitely don't want that. So if they have an advisor who isn't comfortable with that, being able to ask your advisor for alternatives, right, and other resources of people and places on campus where they could go to be able to talk about what they're struggling with.
And Dr. Joe.
Yeah, all great responses. The only thing that I'll add is kind of along the lines of what Dr. Jones was saying, that as a student, having in mind what you would like to share, when you would like to share it, and also what you expect out of this disclosure. Because what you wouldn't want is for a student to have a certain expectation of a response of an advisor and that not be communicated or that not be experienced. So knowing what you want, like what do you expect your advisor to do, or what is it that you desire out of this disclosure in this interaction? And then similarly to what Dr. Jones was saying, is determining if this particular person is the appropriate person to make this disclosure to. And knowing as a student, similar to what Pearl was saying, that there's some empowerment here. As a student, you can decide at what point you want to share information and with whom, and getting a good sense of who those allies that you have might be is going to be really important. So you might decide to share sort of on one level with an advisor that you don't know very well, kind of on a surface level, but you may find that there's someone else who is maybe an informal mentor that is in your space that you could maybe share a bit more deeply. So I think having a sense of what your network looks like and making a clear decision about who, with whom, and when you would like to share information and what you want out of that conversation.
Thank you. Excuse me. So the next question I was going to ask, so let me ask you, but I did add on to the question. So the question was, panelists, how can faculty encourage their students to understand that additional understanding and breathing room is needed in a time of world crisis? However, what I've added to this question is there are three crises, I would argue, that are going on now: political, racial tension, and the pandemic. So you have these three crisis situations that I would imagine affects, a student's approach those or deal with those differently, number one, and then also depending on the ethnicity of the student or the gender of the student, if you will, sex of the student, it impacts them differentially. So I guess my question for you is, considering the political, the racial tensions, the pandemic, as a collective or even individually, how would each of you what advice do you have for encouraging students to understand that additional understanding, or faculty, that additional understanding and breathing room is needed in a time of these three crises? So whoever wants to start, Dr. Joe, Jones, or Pearl.
I would say that I feel like self-awareness is key, right? I feel like sometimes we have expectations of other people that just aren't realistic. And I think, I've seen a lot of either mentors or professors kind of have these really high expectations of students academically and things right now. But based on what's going on, I feel like that's just not realistic. And when we think about, like, we are struggling, right? We as faculty member or as educators are struggling mentally, emotionally, physically, sometimes. And I feel like we need to think about that when putting these expectations on our students. So if we're struggling and we need breaks and we need, time off and things like that, it's only reasonable for our students to also require those same things right now.
I'm trying not to yell preach, because everything that Dr. Jones just said.
You can do that. That's okay to do. Right.
It's right on. So, and I'm a faculty member who has high expectations for my students all the time. Like, I have high expectations for my students. They know I love them dearly, but I do have high expectations. I have standards. At the same time, I am a human being and I have compassion for human beings. And sometimes faculty members forget that part. We can lose our humanity at times and lose that compassion for other people. And it's possible to maintain standards and to retain our humanity and our compassion at the same time. So that's probably the first thing that I would say to faculty. And then I would also say, since we're dealing with academics, I would point them to the research. I mean, the research is very clear how mental health is being impacted and how it has been impacted in the past 6 months that we've been dealing with COVID, how it's impacted people's mental health as it relates to racial injustice. When you're talking about communities of color and even people who just care about racial injustice. And you can look at the data since our last presidential election and know that particular groups of people have been disproportionately impacted. So we're talking about a tremendous amount of anxiety that is being held by just about everyone. Concerns about depression, concerns about substance use and abuse, intimate partner violence. People are facing food insecurity, unemployment, instability. All of these things are compounded. So even if we can't kind of appeal to faculty's like humanity and compassion, which they should have, hit them with the data. Like, the data says that everyone's mental health has been impacted this year, and we cannot ignore that even when we have high expectations.
I completely agree with what Dr. Jones and Dr. Joe said. I think in addition to being self-aware, just being flexible, from the perspective of a doc student, when we get an additional day to submit an assignment or to submit something, it honestly feels like we celebrate in our cohort group meet. So just those little moments of joy, and if it's in your bandwidth to be able to do that, that's really great. And then I would say providing a space for students to breathe and sort of unpacking a lot of the crises that are happening in your classes, if you're able to do so, or in a different setting, has been really helpful. For example, our HESI program, which is like our department, we had this program that had master's students, doc students, and professors, and we discussed anti-Blackness. And these are representatives from all of those groups, but it was so helpful to talk about what anti-Blackness means to all these different individuals who come from different education and different racial backgrounds. But we ended that by talking about, so that was great to really unpack, but we ended that by talking about how do you see Black joy in our program? And for me, that was such a beautiful way to end. And I was able to share that I had just been on a panel for an info session for prospective students. And I would say 90% of the people who had their cameras on were presenting as people of color. And of that, the majority were presenting as Black women. And for me, I was so joyful in seeing that. That was beautiful, that was amazing. And being able to share that with everyone else in that Zoom room was so great. So I think having those moments where we can bring some joy out of a lot of the difficult situations that we're going through has been really uplifting.
So I appreciate that, Pearl, what you just shared, and you, Dr. Jones, and Dr. Joe as well. And it made me think about this. So each of you are in a department within a college, but let's keep it at the department level. What advice do you have for faculty members or staff, to be advocates for students, Black and brown students and women who may be shouldering the burden and the stresses of what is occurring, especially as it relates to the racial tension and the politics that are going on, which is part and parcel of that, when in fact these students may be in departments where faculty simply just don't care and they brush it aside. So what advice do you have, for students and how they can navigate those and what they can do when you may have colleagues that just aren't buying it, if you will?
So I'll say that I've gotten to the point where I can't wear a mask with my colleagues. And I recall earlier this summer having a department meeting, and we're on Zoom, and I had my camera off because I was like, I can't do it today. And they ask, how are people doing? And I was like, I'm just carrying the weight of being a Black person in America. And I said it that frankly with my colleagues. And I said it intentionally so they, of course, could know where I was, but also get a sense that your students are experiencing the same thing. Because sometimes, faculty, they don't believe students for whatever reasons. But I spoke to them as a colleague and said, this is what we're wrestling with. Like, this is how we, as the people who are supposed to, be the instructors in the space, are feeling. Your students are feeling that as well. And they're recognizing that there's a power dynamic with you as their instructor where they don't know that they can express that. So I'm going to express it for them so that you get a sense that this is what's happening. And you need to have these conversations with students. You need to open the floor, just like Pearl was saying, you have to make space in your classroom for students to be able to talk about all of these things, because believe it or not, they're feeling it and they may or may not feel empowered enough to bring it up.
I totally agree with that. I think that because a lot of people don't want to believe that it's actually affecting our students, I feel like when we model that behavior as Black faculty members, like no, we know our kids are struggling because we're struggling, right? Like, it was hard to wake up today, or like it's hard to show up to a meeting. And I think just what Dr. Joe was talking about wearing a mask, and not the COVID mask, y'all should definitely wear those, but this like mask that we as Black people have to wear to make white people feel comfortable on a regular basis. It's hard for us. And I think in a time right now, of course, we want to support our Black and brown students, but I feel like what people don't talk about, like us as faculty members, we always have to do our regular stuff, but as faculty members of color, we also have to do the extra work of supporting all the Black and brown kids, whether they're our students or not, because it's typically maybe one or two of us in the entire department, right? So all the kids come to us. So that's even more of a challenge. I won't say a burden because my kids are never a burden, but like that's an added challenge, plus dealing what we're dealing with, right? In terms of this racial pandemic that we're struggling with. But I think it's important for like our white colleagues to know. I know a friend of mine was talking about like, I think right now a lot of white faculty members are like, oh, like, well, what can we do? How can we fix it? Like as if it's a brand new problem, but we've been Black our entire lives, right? So it's just frustrating. Like I have to take care of myself right now. I don't have time to teach y'all and do it. Like there's research and data and all these other things. So I feel like right now we need the other people in our departments to support us so that way we can then support our students as well. And I don't think that departments are checking on their faculty in general, but they're definitely not checking on the mental well-being of their Black and brown faculty members.
Yeah, listen, I don't, if I had a mic for each of you, I would drop it simultaneously right now because you all are doing that today. And I'm going to give you attribution, Dr. Jones. I love what you just said. We are in a political pandemic, a racial pandemic, and a viral pandemic. Let's be very clear about that. And I'm not one to mince my words. I'll make it very clear. So I'm in 1,000% agreement with that. So let me move on to the next question. And Dr. Jones, I'll start with you with this question. Is it appropriate to recommend mentees or students seek out professional counseling when mental health issues surpass our mentors' abilities or comfort to address? If so, what is the best way to do so?
I feel like it's not just appropriate, it's an expectation. I feel like you should know what is in your highest or like your ability to help support your students. And I feel like some people, they let their egos kind of get in the way, like, oh, I got this. I'll take care of the student. But if they're struggling with mental health, they should see a mental health provider, right? Like that's what they are there for. So I highly recommend mentors, faculty members, whoever it is, to make sure that our students are getting the resources that they need. And in terms of the best way to do it, I feel like actually letting students know about the resources on campus. And of course, there are some universities are better at that than others. And I feel like even if that means going with them, like I had a student that was like really traumatized, but didn't feel safe enough to go. So I went with her, walked her to the counseling center and just sat in the, I was going to say living room, sat in the lobby and just kind of waited for her, right? So she felt, loved and supported and things like that. And I feel like sometimes we have to go above and beyond for our students, even if that means recommending them to somebody else.
And Pearl, we'll go to you next, but I want to mention everyone, don't forget, put your questions in your chat. We want to get those fielded, so just don't be mindful of that. So Pearl, how would you respond to that question?
I completely agree with what Dr. Jones said. My immediate response to this question was absolutely. I'm not a mental health professional. I'm not equipped to be able to deal with whatever the student is going through. And I always let them know that because of my job, I am a mandatory reporter. And I clarify because I think that there's this idea of, oh, that means my parents are going to find out. That means if I say something that student conduct will be notified if it has to do with some incidents of violence. And I let them know that that's not the case. I really am here to provide resources and to connect them with the people who can best help them. And I agree with what Dr. Jones said when I call CAPS with, I call counseling and psychological services with them. I walk them over if needed. I personally put them in contact because I think that initial step is very intimidating to seek out, to walk into that physical space by yourself. And also, I've sort of had to become accustomed with what Dr. Joe mentioned earlier, which is asking up front, are you having any thoughts of harming yourself or others? And knowing how to act appropriately based on their answers. And just asking open-ended questions to them just to really gauge where they're at and going from there to provide the right resources because I don't know how to deal with all of that.
Good. Dr. Joe.
I'd say yes. I have nothing else to add. They said it all. So yes. Please connect them to a mental health professional.
Okay, good. So next question is, and we'll start with you again, Dr. Joe, for this one. What recommendations do you have for people to unwind mentally and emotionally while still social distancing? And, keep in mind, there are a lot of students that we all mentor and advise who are extroverts, who thrive on personal interaction. So how would you respond to that question?
Yeah, and this has been a challenge for everyone, for introverts too. I'm an introvert, so it's even been a challenge for me because I do like people. um, so I think that when we think about our wellness overall, I think it's really important for us to remember what we value and to take some time to think about what and whom we value. And I often ask my students about this. So just actually this week, I had my students take some time to think about times when they were extremely happy or they were very proud or felt very fulfilled. And we explored what those experiences meant for their values, whom was important in those experiences, and what did they mean to them. And from that conversation, we then talked about shaping our wellness plan around those values and the importance of keeping those values at the center. So often we talk about being kind of balanced in life, and we know the reality is, especially at times like this, is very difficult to be balanced. It's kind of difficult to have everything perfectly in balance. And instead of that idea of balance, if we have an idea of remaining centered with our values as the core, that can help us when it even seems like life is still a little bit unbalanced, right? So when we think about what's most important, who's most important, it might be family, quality time with friends. It might be our alone time. It might be physical fitness, whatever it is that we value or think is important. We keep that kind of as our center. And then we make a plan to do some things that will strategically engage the things that we value. In a time like that we're dealing with right now, there are so many things that are out of our control, but there are many things that are within our control. And so if we have to really take the time to reflect on what we think is important, who we think is important, how we want to safely engage with those people in a way that will be mutually fulfilling, and then make some plans to do that and recognize that my plan is not going to be the same as anybody else's plan. And that's okay, because it's unique to me and what I value and what I need in my world. So there are some people, their wellness is about physical fitness and they want to run 10 miles a day. And that's just not me. I will never run 10 miles a day. that's okay, right? So I established my own plan that will be effective for me. And I think that that's what's really important, that we have to focus on our values. Who and what we value, and make our decisions based on that.
Dr. Jones.
I would say something that is really important is giving yourself permission to feel. I think right now people want to hide what's going on, and maybe not even intentionally, right? Like they just are like just focused on work or school or whatever it is, and they haven't given themselves time to actually like sit with what they're thinking and what they're feeling and things like that. And I feel like even if that means grieving the loss of something, right? And not necessarily like our loved ones and like losing people to COVID, but like just like things that, you know, or events that, you know, that we were looking forward to. So for example, I finished my PhD this summer and I found out this week that graduation has been canceled, right? And for me, I was as a first generation student, like I was super looking forward to walking across that stage, right? So like even giving myself this week, you know, to cry about that and grieve the loss of what I thought was going to be a really happy day for me. So I feel like that is really important. And then also thinking about things that you're looking forward to after all this is over, right? Because I feel like a lot of people are struggling with reasons to kind of keep going and things like that. So I feel like if we kind of write down a list of things that we're excited for or looking forward to, it kind of gives us a reason to keep on going.
Really appreciate that. And I do want to acknowledge Dr. Jones. I read your post the other night, and you know, how you shared how you were feeling related to graduation being canceled. And I do want to make it a public share that I really appreciate that. I really learned a lot from that post, and I would imagine there are others who probably feel that way. So I really appreciate you doing that and being willing to share that side of you. So I wanted to make sure I said that today.
Thank you for that.
You know, no problem. So Dr. Jones, I want to start with you for this question. What are some positive coping mechanisms that have worked effectively in your mentoring relationships with students?
I think something that works for me is just consistent check-ins with my students. Because I feel like oftentimes, kind of what I was talking about previously, I feel like people don't give them time, their self time and space to feel, but they know if I'm meeting with Dr. Jones today, she's going to ask me what I'm thinking and how I'm feeling and things like that. So I feel like even if for the rest of the week they don't think about it, at least for that hour that we have together, I know that they have a place, you know, to come to and cry and vent or do whatever they need to do for themselves, and really working with them on finding joy in terms of the positive things that are still happening for them, right? So like, yes, this is a very hard time, but like finding pockets of joy and things that we are looking forward to or like really excited about. So like, yes, I won't get to walk, but I'm a whole doctor now, right? And I wasn't that prior to COVID, right? So being able to kind of focus on those things. And I always recommend that my students kind of keep like a little box or jar or whatever with all of these things in them, so that way when they're struggling, they can kind of reach in and pull one out and be like, oh, like this, you know, did this happen or this happened? So kind of just because I feel like our mindset can be skewed, and which makes sense based on right now. So being able to redirect our thoughts to something positive, I think is really good for our mental and emotional well-being.
We'll go with you next with the same question. How would you respond?
I'm sorry, I don't know who you said.
I said Pearl, but yeah, I'm sorry. Yeah,
sorry, didn't hear the Pearl part, Levon.
No worries.
I'll answer this question from how I personally cope, because it is hard and tiring to literally live with your students 24/7, especially because we're not allowed to really leave and physically go to classes or physically hang out with friends or go on vacations or anything. You're pretty much stuck in this house with your residents at all times. So I always take Pearl time, and my residents know that, and they know that I have boundaries and that they shouldn't be knocking on my door at 11 p.m. And I think going off of what Dr. Jones mentioned earlier about giving yourself permission to grieve and to feel, I give myself permission to do nothing and not feel guilty. I know that there's like the term guilty pleasure, but I feel like if it brings you joy, you shouldn't feel guilty about it. Like that in itself is enough, and that in itself makes it a good thing, you know, as long as you're not doing something that is harming others. So for me, that can be, you know, watching really bad reality TV shows, but in that moment, it's what I need. And I can't beat myself up over not being productive, not doing that extra reading, not writing that op-ed, because that's what I'm doing to love myself in that moment. And this is very like cheesy, but I love that RuPaul quote when she says, if you can't love yourself, how are you gonna love anybody else? So I know I always put my students first, but I have to be right up there with them. And so practicing self-care, practicing that self-love is how I cope.
And Dr. Joe, we're going to come to you, but I want to again remind everyone, after Dr. Joe responds to this question, I'm going to field questions from the participants. So please place your questions in the chat. So Dr. Joe, how would you respond to that question?
So what I do is similar to what Dr. Jones mentioned, is intentionally making space for students to process and share and to check in. I'll do mindfulness moments with students, and we might do some directed mindfulness activity, or we may just kind of open it up for people to share how they feel. And I also, just in interaction with students, try to be keenly aware of what's happening with them in the moment. And so at times I'll just stop the business and let's put that aside and let's deal with what's happening right here in the room. So using that immediacy, I think, is really important, and that we can all kind of get a sense of how people are feeling and doing through nonverbal communication, facial expressions, body language, all of those things. Even on Zoom, we can pick up on those things as well. So I try to pay attention to that, to see the messages that students are communicating without words, to get a sense of if we need to stop what we're doing to just have some time for them to process. And just, as I said before, like, we had to maintain our humanity and compassion. And even as we're trying to take care of business, we have to maintain it.
I really appreciate it. So I want to move into the questions, panelists, and bear with me because I want to read this. I did receive permission from Evan Feldman to read this. So I'm going to read it. So everyone, please follow with me, especially panelists, because there's a question at the end. So it says, hi there. So my experience with mental health is convoluted. I have ADHD, anxiety, depression, and trichotillomania. I put in the work of dealing with mental health. I've upped my exercise and lost 100 pounds over the past few years. I've seen a therapist weekly for a decade. I'm working with a psychiatrist and an ADHD coach as well. I have open conversations with my professors and my students about mental health. I have a friend group that I can rely on and a good connection with family. I've tried eating well, taking certain multivitamins, having a consistent sleep schedule, and establishing a schedule. I've also tried to set up accountability buddies, work outside the home, and work on the mindfulness meditation. Even with all of this, I still struggle tremendously with executing executive functioning and implementation of daily tasks. I'd like to ask the panel, what steps should I take? What can I do? I'm struggling tremendously and would like guidance. So thank you to this individual. So I would open it up to whoever wants to start, Dr. Jones, Joe, or Pearl.
Thank you, Evan, for sharing all of that. We appreciate you hearing that. It sounds like you have taken the steps to get help that you need in multiple areas, and it sounds like you have a network of people who are supportive. I think that the thing that came to mind as I was hearing that was self-compassion, and the importance of maintaining that self-compassion for each of us. It can be very easy for us to continuously criticize ourselves, even when we are taking steps or efforts to make some improvements in our life. And we might feel like we're doing all that we can, or we're not doing enough, or we're not hitting the mark in some sort of way. And I think self-compassion is a very critical piece of that, for us to be able to acknowledge where we are and accept ourselves in our current state. And while we still are engaging in those things that will bring about some change and some improvement in our world, we can take the moment to say, I can appreciate myself in this current place that I'm in, while I'm also recognizing that there are some things that I want to be different. So that is what came to mind. It sounds like you have the professional support and help that you need. It sounds like you have the social support and help that you need. It sounds like you have the internal motivation and fortitude. And it sounds like the only piece that I would sort of add to that is that self-compassion and recognizing that you're enough in your current state.
Dr. Jones, Pearl?
I totally agree with that. Thank you so much. And I love that your camera's on because I can see your face and that makes me feel even more connected to you. So thank you for that. But yeah, I feel like self-compassion is key. I think just because you're still struggling doesn't mean you failed. Right. And as someone that struggles with depression on a regular basis, who takes medication on a regular basis, I still have bad days. Right. But I feel like that doesn't mean that I failed myself or failed my fight against this struggle because I have bad days. Right. So I feel like we're going to be on this roller coaster. So just having grace with yourself. Because struggling doesn't mean you're a bad person. Struggling doesn't mean anything other than the fact then that you're struggling and you're human, right? And sometimes we don't want to feel those parts of being human. I wish I wasn't depressed, right? I wish I didn't have to deal with that on a regular basis. And there were times where I was ashamed of it or beat myself up and things like that, or didn't want to take my meds or whatever it was. But I'm proud of you for being so diligent about taking care of yourself because I haven't always been that way. So yeah, definitely grace and knowing that you are not a failure because you struggled and that you're currently struggling. And I do hope it gets better for you.
Pearl, any?
Yeah, thank you for sharing, Evan. I agree completely with Dr. Jones and Dr. Joe. I would say everything you listed shows all the steps that you took to becoming better. And I'm so proud of all the steps that you took. And also be kind to yourself because you're in a new environment, you know. You just started college again fresh, right? And that's great. That's amazing. The fact that you took all those steps to go to college, like be in this new environment. So I think understanding that there are going to be struggles and difficulties, like Dr. Jones mentioned, doesn't mean that you failed. You know, if you look back on all the things that you've overcome over the past like several years, I think that's so amazing and that's something to be proud of. So just recognizing all the amazing things that you've done, being kind to yourself, like being compassionate to yourself, recognizing that you are doing great, that you are doing amazing things. And just because you have a difficult day, just because something isn't, you know, feeling the best for you doesn't mean that you failed in any way. You've come so far and I'm just really proud of you.
Excellent advice. Next question we have is, I would love to hear suggestions about how to help your students find resources and support online if they aren't available or useful in their local community, both formal and informal. So whoever wants to start out with the response to that.
So I think that the place to start is going to be with whatever counseling center is on campus. I think that CAPS, as we have CAPS on our campus, you may have on yours. I think that is going to be an important place to start because it's likely that they have resources or information about what's available in the local community. And they're also going to be able to connect you with resources that have been vetted in a sense. So what can be concerning is if we sort of get online and start Googling stuff and we're not quite sure what we're going to get or who's going to be providing us information. So there are some reputable resources that we can access online. And there are also some that may not be so reputable. So I would say starting with what the university has provided for students in terms of counseling and support in that area. And they may have particular resources that are either local or online that can be accessible for students.
Sorry, Paul, go for it.
Okay, sorry, Dr. Jones. I would say definitely CAPS is great. The only other thing that I would mention is that sometimes CAPS might not be accommodating to all of your different identities. So seeking out resource centers, like I know our LGBT resource center has amazing events, amazing people that you can be put into contact with. And a lot of their events have been around mental health during the pandemic. Also, the Asian American Community House, the African American Center, a lot of them are providing resources that are more specific to those populations that might be more reflective of the struggles that you're going through. So I think having those sort of more personalized resources has also been really helpful.
There are two organizations that I always recommend. So the JED Foundation, they specifically focus on increasing mental health awareness in colleges. So they have a lot of really great resources on their website. And then the Steve Fund, which also focuses on the mental health of college students, but they focus more on Black and Brown students, which I think is critical because unfortunately a lot of the counselors that are on campus aren't culturally responsive in their approaches, and especially the work that I do in terms of, racial microaggressions and racial battle fatigue. Our students will need someone that actually knows how to handle those issues. And the Steve Fund has a lot of really great resources. So JED Foundation, which is JED Foundation, and then the Steve Fund.
Thank you. Someone mentioned, can someone type the name of those two resources? So Stephen or someone from the MAP team, could you try to put that in the chat for everyone while I go to this next question? I have three. I want to get through these three questions. So this is actually, I like this question, panelists. Since the professors talked about the stress faced by Black people, I was wondering, would you say that white people are also facing similar pressure? So whoever wants to respond to that can respond.
Can you read that one more time? I was to type
that's
the
no
organizations in the chat.
No worries. Since the professor talked about the stress is faced by Black people, I was wondering, would you say that white people are also facing similar pressures? Or pressures, for that matter, at all in terms of those three pandemic situations I spoke of earlier?
I would say that from my experience, they're not experiencing the same pressures or even similar pressures, but I think they are still struggling and they still have pressures. For example, I'm a part of a research team that was analyzing some of the responses that students gave to a residence life survey. So they talked about any times where they felt like they were discriminated against because of any of their identities. And I was actually really surprised that the majority of people who had the most negative experiences were people who identified as white males. And so it wasn't the response that we were particularly looking for, and it's not particularly my area of expertise, but I do think that they still are struggling with how to navigate their identities in these spaces that really contradict and conflict what they've grown up with their entire lives. So I think checking my biases and understanding that although my work is catered towards serving a specific student population, that I need to check my biases and really serve all of my students. And I say this especially because I'm the resident director for a sorority house on campus, and every single person who lives in my house is a white woman. And I was really nervous going into that situation. And there's still things that we have to discuss and there are issues that we have to work through, but still like the struggles that they face, while they're not related necessarily to race, definitely are still real. I've had students have to go back home because they're dealing with mental health issues. I've had students, break down crying, and that's still just as legitimate, but in a different context, I would say.
Dr. Joe, if you don't mind, I really want to get to this next question, and I kind of want to direct it to you because I want to get through these last two, if you all don't mind. The question is, what do you suggest doing if a student who is obviously struggling to the point of suicidal ideation refuses to seek professional mental health care?
So if you're talking about someone who has verbalized suicidal ideation, has a plan, so we use what's called a SLAP assessment to determine if an individual has not just an idea of suicide, but actually has a concrete thought about it, has an actual plan, has a means to follow through with that plan and opportunity. So if yes, that is the case, and they are a danger to themselves, and there's like a clear need for them to get help, and they are not volunteering to do that, then what would be the next step would be contacting the authorities in your community to get that person the help that they need, even if it's without their consent. So here in Florida, it's called Baker Act, because that is the law that is used. So if someone is a danger to themselves, then there might need to be contact of authorities to have them committed to a hospital so that they can get the care that they need. That's of course in situations where there is like an imminent concern about that person's safety. So this would be different from someone who is saying that, you know, I'm kind of sad and I don't really want to be here, but they haven't really thought out a plan. They don't really have a means to it. They might even say, well, I don't really mean that. I do want to live. I mean, there have to be some really concrete questions that are asked in that situation. And so if a faculty member does not necessarily know what those questions are to ask, then they should know who are the people who are around them that know the questions to ask and can ask those questions and get the person the help that they need, even if it means involuntary admission to a hospital.
Thank you, Dr. Joe. Before I get to you, Dr. Jones, I do have one more question. I think the other question we addressed, but this one we didn't. I do want to say thank you to the Dean of our grad school at Purdue, Dean Mason, for the information she just put in the chat. But Dr. Jones, here's a really good question. What strategies would you recommend for dealing with the constant uncertainty that we're feeling at this moment that comes along with the overlapping crises you mentioned earlier? And I did, for this individual, I wrote down optimism because I was going to ask something. So this person was thinking like me. So Dr. Jones, how do you deal with trying to yourself maintain some sense of optimism and also extend that to students? So how would you respond to that?
I will speak for myself and how I do it. And first, some days I'm not optimistic at all, right? There are some days I'm like, I want to flip over tables and I'm mad at the world. And if I watch CNN for 5 more minutes, I might pass out. So like I have those days because I'm human and I feel things. But kind of like I was saying earlier, like focusing on the positive things that are happening. And I lean on my village. I have an amazing village of friends and colleagues and family members that I feel like allow me space to talk about what it is I'm struggling with. And hopefully on the days where I'm having a really bad day, one of them isn't, right? And then we can kind of lift each other up. And if we're both struggling, then we'll just cry together, right? Which is still therapeutic and helpful. So yeah, I would definitely recommend leaning on your village and focusing on the positive things that are happening. You're muted.
I'm sorry about that. Dr. Joe, did you want to respond to that at all before we close out?
I, of course, as a mental health professional, I advocate counseling. So, you know, seek out professional help. There is no shame in it. I actually started seeing a counselor in March, just before COVID really hit. And I was so glad I had made that decision because I absolutely needed it over these last 6 months. So certainly, you know, consider that as a possibility. It doesn't mean that your life is falling to pieces or whatever. I mean, there are a number of reasons to seek counseling, and we've got to break the stigma around that and reach out and ask for help when we need it.
And Pearl, anything you want to leave us with?
Oh, I think the doctors covered it really well. I agree with everything that they said.
Okay, thank you. So let me, we just struck the hour of 1 o'clock. Let me say just 1,000 times over, I really appreciate Dr. Jones, Dr. Joe, Pearl, all that you contributed to today's conversation. I thought it was fascinating. You each did a phenomenal job, and I really am grateful that you all were able to share your time and your energy and all the advice today. I really appreciate it. And on behalf of the MAP team, we thank you. I have a great team. I don't do this by myself. We have a great team with Stephen and Dr. Knobloch and Victoria and Ariane and Zach and Andres. And I'm missing someone, team. I may be missing someone. We have a great team here, so I couldn't do this. It's a collective effort. But today, your contributions were just phenomenal, and I really appreciate that. So everyone, you have resources in the chat. Please cut and paste those and share those with your colleagues, with your friends, with your peers. And all I would say is, everyone, please be well, be safe. And we have one more workshop next month. And just let me plug it. It is November 18th, Mentoring for Career Readiness and Advancement Beyond the Academic Setting is the last workshop of the semester in November. So again, thank you to everyone. Really hope you learned something today. And again, thank you, Dr. Jones, Dr. Joe, and Pearl for being with us today.
Thank you for having me.
Thank you so much, Levon and Matt, for having me.
This is great. I appreciate being part of this.
Thank you. All right, you all be well, and we'll be in touch. Have a great week, everyone.